Chairman Conrad has emphasized how important it will be to tackle the major issues, health care reform and the issue of climate change, in a bipartisan way. I want to spend a few minutes first expressing my support for that position and urging that the conference on the budget proceed expeditiously, because then the heavy lifting for the United States Senate will begin. For example, on American health care, what is needed is nothing short of a transformation of our system. American health care is simply broken. Medical costs are gobbling up everything in sight. Middle-class people know that their paychecks aren't going up, and the primary reason is because medical costs take away all of what would otherwise be a wage increase. Our newspapers report daily that Americans are being laid off at their jobs. They lose their health benefits, and what we see again and again is a spiral of tragedy as they simply lurch from one effort to another to try to find health care and can't get it. Now, Madam President, this is not going to be fixed by a piecemeal approach to health care reform that tackles one part of the system or another and produces incremental change for perhaps a short period of time. What's needed is transformational change, and I believe Democrats and Republicans here in the United States Senate are committed to that objective. I think that there is a growing recognition, Madam President, that both parties have had a valid point. Democrats, in my view, are correct that you can't fix this unless you cover everybody, because without that you can't organize the market. There's too much cost shifting. There's no emphasis on prevention. You've got to get all Americans good quality, affordable care. Republicans have valid points, in my view, as well. You shouldn't just turn everything over to the government and say that's the answer. What's really needed for transformational change is containing the costs. And the Congressional Budget Office, Madam President, last May said that for the amount of money America is spending today on health care, all Americans in a couple of years could have good quality, affordable coverage like their member of Congress. That's what the Congressional Budget Office said when it looked at one approach to dealing with it. What it means, and I'm very confident under the leadership of Chairman Baucus and Chairman Kennedy, that they will have a lot of support for transformational change, is we make sure that all Americans have access to good quality, affordable choices, and they get rewarded when they take sensible steps, for example, in preventive health care and wellness, and shop carefully for health care coverage. Today, Madam President, if you're lucky enough to have health care coverage, you don't get any choice at most employers. That's not the way it is for members of Congress. So why don't we agree, Democrats and Republicans, after we get this budget conference put together, that we're going to make sure that all Americans have good quality, affordable choices like members of Congress have. Then let's start rewarding them. Let's reward them for sensible prevention. For example, the Safeway Corporation has been doing that for some time. I'd like to say that seniors who lower their blood pressure and lower their cholesterol would get reduced Part B premiums. That's the outpatient portion of the Medicare budget. But these are areas where Democrats and Republicans can come together. There's been considerable discussion here on the Senate floor about the idea of reconciliation for tackling health care. I think Chairman Conrad is absolutely right in his approach. And I will say, Madam President, that there have been many of us on both the Democratic and Republican side, as we've looked to health care, who want to make the issue of reconciliation irrelevant. We want to make the issue of reconciliation irrelevant because we are hoping to bring enough Democrats and Republicans together so that we'll have 70 or more United States senators gathered to fix the health care system. These issues ultimately, in my view, are not ones that automatically produce a partisan divide. Today's private insurance model is also broken. It's all about cherry picking. It's about taking healthy people and sending sick people over to government programs more fragile than they are. So what Democrats and Republicans want to do, again in the name of transformative change, is we want to say the companies are going to have to take all comers. We understand that that's a key part of health care reform, but we're going to put them all on equal footing. There aren't going to be any price controls or big federal regulatory systems, but everybody's going to be part of a big group so we contain costs, part of a big pool. We'll reward prevention and wellness, which of course isn't done today. And this is something where I think it will be possible for firms in the healthcare area to both do good and do well by offering better service to our people. Other areas of transformative healthcare reform, the issue of portability and making sure that our people can take their healthcare coverage with them so that they don't lose their coverage when they lose their job or they wish to leave their job. That's what happens today, and of course much of the healthcare system doesn't offer that kind of portability because it's built around what happened in the 1940s when somebody started working and stayed put for 25 years until you gave them a gold watch. Well, today the typical worker changes their job 11 times by the time they're 40. We need portable coverage. Democrats and Republicans can work together on that. And I want to close, again in the name of bipartisanship, by talking about how we can help people who have coverage. They've been described by some as the contentedly covered Americans. I think what we ought to say for those folks, Democrats and Republicans, let's let them keep the coverage they have. Let's make sure that they're wealthier in the new system because they get rewarded when they engage in those preventive practices or make a good purchase. Let's make sure they're healthier in the new system. Chairman Conrad is here and has talked about improvements, for example, in chronic care, which is certainly part of making Americans healthier. And finally, let's make sure that if they leave their job or their job leaves them, as I've touched on, that they're going to have a safety net of affordable coverage. Each and every one of those points that I have talked about, Madam President, is an issue that Democrats and Republicans can come together. I hope that the Senate will follow Chairman Conrad's advice about proceeding expeditiously here. I think there are many members of the Senate who want to tackle these big issues, climate change and health care, in a manner that makes reconciliation irrelevant because we have brought together the kind of broad majorities that I think are particularly within the grasp of the United States Senate on this health care issue. And I look forward to working with colleagues on both sides of the aisle for exactly that kind of transformative policy to better meet the needs of the American people.